parking dot signature, huh?
Well, I'm starting down.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you. We'll call this meeting March 26, 2024 to order at 8:30 a.m. Chair will make a motion to approve the agenda as presented.
Second.
Motion and second. Any further discussion? Hearing none. All in favor?
Aye.
Aye.
Aye. Motion carries. Chair will also make a motion to approve the consent agenda A through J.
Second.
Motion and a second. Any further discussion? I don't see anything out of the ordinary on the consent agenda. So, all in favor?
Aye.
Aye. Motion carries. All right. So we do have a public hearing at 8:45, but we'll try to get through a couple of these things before then. And so And so I think we'll go with Angela. You got 15 minutes. Is that good, you think? Yeah.
Public comment.
Oh, sorry. Before that, public comment. My bad. I was trying to get ahead of the game. Anybody have public comment? Come to the front. You have 3 minutes. Please state your name. Please state, you live in Moffett County or not, and tell us your concern. Sorry about that. Thank you.
Good morning, Commissioners. Tracy Winder, Craig resident. I'll try to be really quick. In 2017, the Department of Homeland Security officially designated election machines as critical infrastructure. As such, election systems must be as free from foreign influence and operations as possible. Approximately a week ago, Michigan County Sheriff Dar Leaf sent a letter to Jim Jordan of the U.S. House Oversight Committee urging a congressional investigation into evidence of foreign interference in the 2020 election, among other allegations. Here is a very condensed version of the sheriff's letter. And this is the sheriff talking. He says, "My office has evidence that foreign nationals have accessed electronic voting machines in Michigan and other states. This evidence demonstrates that electronic voting machines and electronic election systems are not secure, and an immediate investigation is needed by Congress. I have evidence in my file of Serbian foreign nationals entering our election system while the votes were being counted and prior to certification. The election vendor, Dominion, hired these Serbian employees and disclosed in emails that they are not able to provide backgrounds on these individuals due to Serbian law, and that has been confirmed. I am investigating the role that some individuals inside the United States have played in conspiring with these foreign nationals and who have even instructed them to access and interfere with electronic voting machines and voting systems during past elections, and that U.S. Dominion and its affiliates instructed employees to alter or otherwise falsify the integrity of the software and hardware in its systems to attain certification by the Election Assistance Commission, even when they knew that the systems could not be properly verified and certified. Additionally, I have evidence that the voting machines and systems are vulnerable to alteration and manipulation, such as interference by use of external devices that can be connected to voting machines before, during, and after elections. As I now have evidence that our election equipment is not secure, and because election voting machines prevent transparency, and vendors have more oversight and authority to have them examined than the officials that are charged with their constitutional duty to ensure our elections are secure, I am presenting you with this letter and initial tranche of this evidence so that you will be compelled to investigate these criminal acts and breach of our national security. And by the way, oh, is that my time?
Hey, go ahead. Finish up and we're just closing.
Here's the important part. In light of this evidence, I am suggesting that every election official consider an emergency backup plan for upcoming elections to prepare to verify all ballots and voters, and to hand count actual paper ballots at the end of elections to confirm the accuracy of the voters, and that our election machines are working properly. I'll give this copy to Aaron in case you got, there's a link here if you want to read the whole letter.
Yep.
So thank you.
No, thank you, Tracy. Anybody else for public comment? Be able to discuss anything going on in the county if you would like. Last chance. All right. Thank you. Appreciate it. Hey, you got 10 minutes? Is that where, can you do that, Angela? All right. So we have Angela Modisette through Integrated Communities. She's going to give us a program update of what they're doing. They are busy. We know that.
Thank you. My name is Angela Modisette. I'm Program Director for Integrated Communities Moffett County Office. Quick little presentation. There's a couple slides of the people that work mainly in our office here in Craig. Jerry Garcia, who is our Executive Director. Myself, again, Program Director. and Renzo Walton, who is our DOJ immigration specialist. He's also recently been promoted to our Director of Immigration. And Evelyn Bacon, who is our Language Services Manager. So, Integrated Community began in a local bookstore during a Spanish-English conversational group back in 2004. The number of immigrant community members was growing quickly due to the high demand for workers. And as the demographics of the Yampa Valley changed, so did the needs of the residents, healthcare providers, nonprofit organizations, schools, and other local resources. In response, more than 75 community stakeholders, including immigrant representatives, met to establish a prioritized list of needs. From this, the heart and soul of Integrated Communities mission was born. Since 2004, our organization is a recognized leader and go-to source for immigrant residents of Northwest Colorado. Our programs continue to respond to the needs of collaborating agencies, providers, and ever-increasing immigrant limited English-speaking population in our community by shifting programs and resources to fill the gaps. Our vision is a united Northwest Colorado where all members have the support and encouragement to communicate, participate, and contribute. Our mission is to assist and support immigrants to integrate, contribute, and maintain their independence in our Northwest Colorado communities. Our focus is helping immigrant community. So some of our highlights are our office opened here in Craig in December 2022. In that time, we had 613 intakes, so about 182 clients and 562 hours of service. So that included myself, Evelyn, and Renzo working with our different programs. And so then our programs. The first program that we have here is specifically in Craig is, or in Moffat County, is our community navigation. So we provide assistance to non-English speaking community members in the areas of medical, employment, housing, legal clinics, and other basic needs. So for example, if someone is needing assistance with applying for a job or yesterday I got someone that was trying to apply for a marriage license, and what are the steps and what are the resources and what are the items that they're needing for those processes. That's how we then assist that client in navigating our local organizations or businesses. The next slide, thank you. Our next program is immigration. Integrated Community is recognized under the Department of Justice to provide immigration services, such as citizenship, employment authorization, DACA, with the DACA renewals, travel documents, TPS, which is temporary protected status, family petitions, and immigration clinics. So Renzo is able to work with these different, the different needs, and has been doing it for a few years now. And people have been able to apply for their citizenship, for their permanent residency, and be part of our community. And then our other services, language services. We provide practical and confidential interpretation and translation services. Our professional interpreters are evaluated, hired, and trained by Integrated Community. So, one of our, actually happened to a client where they've gone to the doctor with their grandchild, and they've been given a diagnosis, not great diagnosis, and then the child is having to translate for them that diagnosis. And so we're able to provide then that that ability to have family members be able to do interpretation or translations for family members. So
This is, and just for the audience, and we've had this conversation, but this isn't just Spanish. I mean, I think we think this only Spanish. That's the only thing that we're doing, but it's way bigger than Spanish. Can you elaborate on that for us?
yes, so most of our clients, a lot of our clients are Spanish speaking, but we also do provide interpretation for French, Fulani, which is a West African language, and recently have had more people Portuguese. And so then we also are able to access other languages as needed. So it's not just Spanish. Thank you. We also do have a strategic plan in place for the next 3 years in regards to our different programs and how we're also looking at how to expand our other programs that we have available in Route County into Moffett County, which includes education programs. So we're looking at where there may be a gap there and hopeful in the near future, figuring that out and if need, filling that gap. So I have a slide for questions if you have any questions, and thank you so much for the opportunity.
Oh, and I didn't mean to rush you at all. If you need
Yeah.
more time, we would let you go after the public hearing too,
No.
so don't. I know I go to a lot of meetings and Angela is at a lot of meetings. Almost every meeting I'm at, she's at, just helping any way she can. Any questions from the commissioners?
Where do we access the information for this? Is it all on our website? Is it like,
It's all on our website. We also have so we have our office in Steamboat, which is 443 Oak Street. And then our location here in Craig is 555 Breeze Street, Suite 110. So I say a lot of the times it's the DMV building where we're located. We see clients from Monday through Thursday, 11 a.m. to 5 p.m. But I take calls anytime between 9 and 5. So,
great, thank you.
yeah.
No, I think that's it. I mean,
Oh.
I appreciate you and appreciate all the work you're doing to keep us updated and keep the community updated in what you're doing. So
Thank you so much.
Thank you.
appreciate it, Angela. No.
You want-
So we'll just jump. We got just a couple minutes before this to talk about the discussion of options for posting of legal ads.
Yeah, so we talked about the fact that our newspaper is only going to print 1 day a week now. And so there's certain things that we do that require posting twice for us to conduct business. And typically we could do that on a Wednesday and a Friday print, but if it's only going to 1 day a week, we wanted to discuss being able to have that information out to the public in a way that they could access it 24/7. So whether that's posted on our website and then backed up with an ad in the newspaper, but looking at how we, when we start the year, we appoint the newspaper as our main point of the KRAI and newspaper for posting our information. But if that's only going to be available to people 1 day a week, we wanted to look at being able to still conduct business, not have to put us 2 postings would mean 2 months instead of 2 weeks possibly. So looking at appointing our website as the official posting site and then the newspaper and radio as our official marketing for that post.
We're not making a decision today. It's just
No, we
for
still-
conversation. We got some.
Yeah, it came up just recently and we need to do a little bit more looking into what we have to do for the resolution and Becky was out of town, so just want to get it in front of us and know that there's, with that change in the distribution, it's going to be changing how we're able to distribute information to people.
Any thoughts? Yeah, so we'll keep everybody updated and make sure that that is posted and cleared and multiple times of this is what's going to be our new outlet once the paper, does the paper give us a date of when they are going? She's not here today. Oh, it's already once a week? Well, it's already done. There you go.
And it'll be back on our agenda in the form
Last
of
week they did more than one
changing
day.
our resolution.
It started this week? Okay. All right.
Okay.
We'll put it back on the agenda. All right, so let the record show for today's public hearing regarding the proposed first supplemental budget of 2024, which was posted in the legal section of Craig Daily Press Wednesday, March 20th, 2024, and posted on the Moffett County website and on today's agenda. Once the public hearing has been declared, I will ask Kathy Nelson, the Moffett County Finance Director, to present the proposed March 2024 supplemental budget to the Board of County Commissioners. Once Kathy has compelled the presentation, the commissioners may ask or make comments. I will then ask the audience if there is anyone who wants to testify either for or against Any interested elector of Moffett County may testify once the public hearing has been declared and all the information has been presented. For those who want to testify, you'll be asked to approach the commissioners, state your name for the record, and you'll be given 3 minutes to present your case either for or against. Aaron Miller will be the timekeeper today. She will notify the Board of County Commissioners and the speaker that 20 seconds remain before your time is up. No decisions will be made during the public hearing. This is just an opportunity for you to provide testimony in favor or opposition for proposed requests. Once all testimony has been heard, the public hearing will be declared closed and we will go back into regular session. I will then refer to the fellow county commissioners to consider approval of March 2024 supplemental budget and any associated resolutions. We have two public hearings, just so we know. We'll start with that one here. So I declare the public hearing to be open. Kathy?
Good morning.
Good morning.
As stated, this is uploaded to the county website, so if anybody had needed further clarification or detail. I'm going to cover, for sake of time, transactions over 10,000. The first one mainly is for any rollovers. We have elections. They are requesting to roll over $15,429.74 from 2023 unspent budget to cover 2024 elections. They are also requesting to transfer $12,655.98 from equipment rental and dues to meetings to cover expenses in operating an even year election. The treasurer's office is requesting an unplanned expenditure of $5,500 to be utilized towards an improved credit card website, which is really IT. And this will be a $5,500 change in contingency. So even though it was unplanned expenditure. The finance department requests to have a downward supplemental of $150,546.81 in ARPA funds that were spent in the 2023 budget year, but were in the 24 budget, so they were late in the year. Development Services Department is requesting to transfer $92,146 from Human Resources Council and Maybell Waste Water Treatment Facility to be used in Loudy Simpson Improvement in Maybell Park. And these are ARPA funds. The Finance Office requests to roll over $4,394,25.26 from prior years to be utilized in the 24 budget, and these are LACTF rollover funds. The sheriff requests to roll over $38,892.69 from equipment vehicles to be utilized towards a vehicle ordered in 2023 but not received until 24. The sheriff's office requests to roll over $14,512.50 of U.S. Forestry Service funds to be utilized towards U.S. Service Forestry expenses. It requests to roll over $23,793.82 from equipment miscellaneous to be utilized towards outfitting 3 new patrol vehicles. $18,443.28 of employee education to be utilized towards employee education expenses. And that was all the sheriff's department. The jail is requesting $6,726.19 of unexpected revenue from JBBS and MAT grant for reimbursing a portion of expenses related to mental health and additional services in the jail. Facilities Department requests an unexpected revenue of $73,588 from insurance reimbursement to be utilized towards the expenses incurred at the county annex building. The airport requests to roll over $26,941.61 of unspent capital funds to be used in 2024 projects. Road and Bridge request to roll over $27,193.27 from repair parts to be utilized towards 2024 repair parts. Rollover of $12,403.05 from sand and gravel to be utilized towards sand and gravel in '24. 22,000 from crack sealer to be utilized towards 2024 sand and gravel and repair costs. Request to sorry. It's roll over. The Maybelle Fire Department requests to roll over $31,322.32 from previous year's unspent funds to miscellaneous equipment to be utilized for future equipment expenses. Public Health requests an unexpected revenue of ARPA SLRF to be utilized towards operating expense supplies. The Maybelle Park requests to roll over $84,920.38 from previous year's unspent funds to be miscellaneous equipment to be utilized for future equipment expenses. The Maybelle Women's Club requests to roll over $21,569.14 from previous year's unspent funds to miscellaneous equipment to be utilized for future equipment expenses. The Moffett County Fair requests to roll over $88,998 from operating supplies to following accounts for the county fair and their various expenditure accounts breakthrough. The library requests to roll over $27,029.45 from capital outlay funds to be utilized towards carpeting in the library in '24. The Moffett County Tourism. So then we go to our total page, which lists our unexpected revenues, our transfers. It just breaks down what the supplement is. Unexpected revenue is $177,474.47, transfers of $261,210.03, increased spending authority of the $5,500, rollovers of $4,911,384.70, downward supplemental of the $150,546.81 for total adjustments of $5,506,116.01. The balance as of January 1st of our contingency is $625. The $55 will come from that. So our balance is now $619,500. And if you look down below, we have an emergency reserve account history, $1,292,870. And this is the reserve of 10% of the current year's general fund budget of operating and expenses. Any questions or further clarification?
Maybe you could explain, just for everybody, the downward supplemental of 150,000. What does that mean?
So when we set the budget, we get the balances, and if money is spent after that towards in December, then it's lower when they actually spent that money in December. And so we go back through and adjust what we estimated for 2024 and lower it by that 150,000 because it was able to be spent on the ARPA project. Sometimes it's can be, I guess, definitely down to the wire. And I think did you want the detail of what was?
No, I was just for explanation.
So just those funds that were spent from ARPA later in the month after the budget was established.
Yeah.
To correct and put the total amount that we have to spend in '24 accurately.
I mean, you can see the majority of our supplemental is in rollovers at 4.9 million of just things that didn't get bought. We couldn't buy them. For whatever reason, we couldn't get done. 2023, they get rolled over to 2024.
Correct.
Not increasing the budget is just simply a rollover for what we had budgeted last year. So, okay. Any questions? Any commissioner? All right. Thank you, guys. I will make note that the emergency reserve account is not our reserves in general. That is just the emergency reserves. That is not the county's reserves. And we're getting all those numbers, but that is just what we could spend in emergency. Our reserves are set aside more than that at 31% roughly. So, hey, at this time, we'll open the floor to anyone that would like to speak as a Moffett County resident on either for or against March budget supplemental of resolution 2024-36.
Like to talk about mine. Robert Rosano, I'm the treasurer. What we're looking to do is upgrade the credit card side of our website. It hasn't been upgraded since 2004, and any kind of computer stuff, you know, gets outdated really quick. It's just really slow. People have trouble using it. We've got over 1,000 people used it so far this year, and that's only in 2 months because we didn't have the tax bills out in January. And brought in almost 900 and some thousand in revenue, but it's really a hard site to use. I bet half of those people call in and have to have our office help them use the website because it's just slow and it's just not customer friendly. So we're looking to upgrade that. And so I think 2,500 of that's the upgrade of the website, and the rest is the additional cost that'll be monthly. It goes from $625 to about 900 a month for the credit card site. But I think it'd be beneficial to the public. It's not really a revenue generator, but it lets people pay their taxes online, and more people are doing that nowadays than, I mean, the first year we had it in 2004, we had 6 payments, and now we got almost 1,000. And I think it would increase a lot more if the site was better.
Yeah, for sure.
So
For sure.
that's what I was looking to upgrade that.
Perfect. Thanks, Robert.
Thank you.
Making things easier. That's always nice.
Yeah, make it better for the public.
Anybody like to speak for or against the March supplemental? Last opportunity. All right. Well, we will come out of public hearing. Commissioners, what is your desire?
Make a motion to approve resolution number 2024-36, the March 26, 2024 supplemental budget.
Second.
Motion and second. Any further discussion? Hearing none. All in favor?
Aye.
Motion carries. Thank you. All right, so then we're going to go into one more public hearing. This is concerning ordinance 2024-0326. It's the adoption of the model traffic code, second and final reading. Again, this was posted in Craig Press February 16th and posted on the Moffett County website. Once the public hearing has been declared, I'm going to ask the sheriff to come and present the ordinance to the Moffett County Board of County Commissioners. Once he is given, we were able to speak to him, and then once that is done, we will ask anyone that wants to testify for or against. Same concept for what we did. You'll have 3 minutes to present your case either for or against what is presented here today. Then I will turn it back over to the commissioners once we come out of public hearing. Nothing will be decided in that time. So again, we'll go back into public hearing. Sheriff?
Good morning, Commissioners, and everyone that's joined us today on this wonderful, somewhat now unsunny day of March with snow and 60 degrees last week, and you know, it's Moffett County. If I may be so bold to invite Becky Tyree, County Attorney, to the table. She has worked diligently with my office and my team to get us to this point with the really updating the model traffic code for Moffett County. As you had mentioned and included in your packet, the model traffic code was introduced on first reading. It's been published. We've had a Moffett County traffic code that has existed in Moffett County for a number of years. It is in essence adoption of the state model traffic code. On a frequency, the state of Colorado updates the model traffic code. And when I talk about model traffic code, some in the room may not understand, it really deals with the movement of vehicles on roadways. And state statute allows and affords counties to adopt the state model traffic code and in essence make it their own. And so that's in essence, what we're doing with this is in essence, adding a fresh coat of paint because the state has updated their model traffic code. And we would like to do the same here in Moffett County so that it aligns with the standard as it exists across the state of Colorado with the movement of motor vehicles on the roadway. I had a conversation with Ms. Tyree with respect to process. Just for information's sake, there is another step in this process where the Colorado Department of Transportation has to sign off on the adoption of the county's adoption of a model traffic code. I would suggest, if it is the pleasure of the board today, to move with this second reading, once we come out of public hearing, that the motion contains some language that stipulates that adoption upon approval and signature of the Colorado Department of Transportation CDOT. So
I concur. That's what we discussed before the meeting, so, it says in the model traffic code, which I have a copy of it, that, in no case shall regulations pertain to state highways become effective until approval has been obtained from the Colorado Department of Transportation. So, because of that step and because the county would like to be able to enforce on state highways and all the highways in Moffett County, the request is that the motion to adopt this ordinance, make it effective after approval by CDOT.
which the prior Board of County Commissioners would have done. I
What should they do?
10 years ago when we worked through this process previously.
Okay, any questions? We went through a couple of hearings on this already, so I think we're good. And I'm glad we caught that CDOT needs to sign off on it so that we're not going against anything. So appreciate that. So anything? No? Okay, thank you guys.
Right. Thank you, Becky.
Thank you.
All right, now it's time. We'll open it up to anybody that would like to speak in opposition or for ordinance 2024-0326, adoption of the model traffic code. Anybody? Last chance. All right, we will come out of public hearing and go back and see what the commissioners would have. I would just state that we're finding a lot of these things, right? I think we did the dog ordinance, and I think that a lot of these things get passed in the 70s and the 80s and the 90s, and we don't keep them up to date. There's so many of those, and so kind of going back through some of those and cleaning them up and trying to make sure that they are good is a lot of work, but it's a necessary deal. And I think that's what we get scared about in our state government, is that you pass 600 laws a year. There's no way you can tell me what law got passed in 1986 or 1999, number 643 or 600 law. We just can't do it. So we want to make sure we're not doing what they're doing at the state, and we can keep track of those and stay on board. So appreciate all the work that's gone into that for sure. So, all right, commissioners, what is your pleasure?
Mr. Chair, I would move that we approve ordinance 2024-0326, the adoption of the model traffic code at the second reading, effective upon issuance of CDOT's approval certification.
Second. Motion and a second. Any further discussion? Hearing none. All in favor?
Aye.
Aye. Motion passes. All right. Now we will go on to our last presentation. We have Memorial Regional Health, Jennifer Riley. She brought a team with it. She brought a team with her today. It's good. Good to see. We are glad that the hospital has a great board.
We do have a great board. We have 4 board members here today. So in
Yeah.
addition to Steve Hilly, we have Dr. Alan Reiches and Roger Richmond and Jonathan McFarland. So
Appreciate you guys being here.
they're here to protect Steve and I. So thanks a lot for having us today. We really appreciate it. This is a presentation that I shared with the community at State of the Community. And then we added some additional detail for our employee town hall meetings in February. And it was suggested that this might be a great place to share some of this information. So Steve and I are going to gonna tag team this presentation. Will probably be about hour and a half, no longer. So no, I'm kidding. It won't be that long. And it's gonna be very interesting. So go ahead.
Is it going to be interesting?
Yes.
Good. All right. My name's Steve Hilly, and I'm one of the Board of Trustees at Memorial Regional Health. And I can tell you right now that it is a real pleasure to be on that board. I've learned a lot, and I mean, it runs really well. And thanks to Jennifer's guidance, all I see is good things happening here in the future. So if you can bear with us, we're going to give a little presentation on some of the goals that we pursued in 2023. And we're also going to talk about some of the highlights and maybe some of the challenges that we've come across in the past year or two. So starting off with our goals, this is a set of goals that we set. We always try to do employee engagement, and employee engagement is really very, very serious to us. We want to make sure that our employees are happy, and when you have happy employees, you're going to have a place that is run really well. So with the employee engagement, we have a couple goals. One of them was to increase employee engagement to measure the satisfaction survey. We tried to get it above 90%. That was a very lofty goal. We understand that. We want to make sure that we get everybody's feelings heard and their thoughts on how to improve the facility. The result was 84%. We did fall a little bit below that, but as everybody in the room knows, if you've ever done a survey before, 90% is lofty, but 83% is definitely a very good, and we're proud that we at least got to 84%.
How many employees?
375. And we had a slight decline in the number of people who answered the survey this year, but I'll let Steve give you that information.
Yeah, we had a number, there's a number of reasons why we had a decline. Some of it had to do with the access to computers. The hardworking staff that we have, especially during the daytimes, like housekeeping and plan ops and so on and so forth, they don't sit around at their computers. They don't do that kind of stuff. And really, a lot of the times it's only accessed through the computers that are at work. They don't have access at home. So with that respect, sometimes it's hard to, although the manager did try to shut them off and say, come on, we need to get this survey done. Work sometimes takes precedence over some of the surveys. Some of the questions we had that were definitely higher. We appreciated the increase, and that was with the praise and the tools that they have to do their jobs. That was one of our surveys. We just want to make sure everybody, has what they need to do. It's always a question, and we always get good response with it. One of the decreases was coworkers' commitment to work and feelings towards their supervisors. And as we'll talk later on in this presentation, that's one of our goals that we're going to work on for next year. The next set of goals was a decrease overall turnover rate of less than 23% as measured through employee turnover report. You can see that what has happened in the last few years from 21 to 23, we're definitely on the right track. We went from 42% turnover rate in 2021 to 24% in 2023. And this is just an amazing concept to get done because, again, it goes back to happy employees are not going to leave, right? At least that's our goal. So we're pretty proud of that. A lot of the reduction was in traveling staff. We started the year out with 19 travelers, and the expense of travelers is astronomical. It just costs so much to keep a traveler. We've had them in radiology. We had travelers in lab. We had travelers in nursing. We've had travelers, pretty much throughout the facility, and especially in the clinical area. But going from 19 travelers and ending the year with 9 is pretty remarkable. We definitely worked hard to do that. And it came out to an annual savings of approximately $1.5 million just to move those travelers out. And you also have to understand that we work very hard to keep up with a big facility sometimes, but bigger facilities with deeper pockets can easily afford these travelers. We cannot, and we're very cognizant of making sure that we try and move them out and get the locals back to working. Recruiting, boy, we appreciate being able to recruit our own. It's very important to us. It's bringing the hometown folks. We appreciate the CNCC for their nursing programs that they have up there and the retention agreements that we can make with our employees or that work through the process at CNCC to become nursing students and then finally employees. It's a great concept. We wish we could have it for darn near every aspect of the hospital that we can fill, on down to sleep techs, to medical assistants, medical lab techs. You know, we could really open the door up and grow our own, I think, with a lot of other, aspects of the hospital. Retention, competitive compensations, we always do a salary analysis. You know, when I worked at the hospital, I was there for 7 years. I always remember them doing that. I appreciated them doing that just to see if they were online with what other facilities were paying. It's a great thing to do. It makes employees feel like, you know, I can't go down the street and get paid more. You know, keeping those employees happy where we're at is certainly, you know, one of those things with the salary analysis. We brought back a 1.5 education benefit, which is absolutely huge. You know, the staff like to be able to go out and further their education. So that was really good to bring back. And we absorbed, this is the big one, we absorbed the full 24% increase in benefit costs with no reduction in benefits. That includes health insurance and, you know, time off and so on and so forth. So that was absolutely an amazing thing to do. I can't thank the hospital for really pursuing that. Along, we gave 3% cost of living increase. So we're trying to keep up with the 3%. It's not a lot, but we definitely are there. Some of the other highlights we have with new service lines, we increased our interventional pain management with 2 new CRNAs. That is really going to help us out. It's already proven to be very bountiful for, you know, our cost. We brought on Dr. Stewart, who is working family practice. We brought in Cassandra Ruche. She's working with peds. We've expanded that capability, which is very good. Jessica Nyquist, we brought in for dermatology. She kind of switched over from one of the orthopedic surgeons to our process in dermatology. And Suzanne Haig is working down at Rapid Care, and they're all doing a wonderful job. Moving on to the pie chart here, I just wanted to highlight this pie chart here as, you know, 61% of our staff that we have at the hospital are clinical. And it's big. I mean, it's a lot of stuff that, you know, these employees do. The clinical staffs, the support staff, we have 114 clinical support staff. It includes the lab, it includes, you know, radiology, the people that help support, you know, the processes that the doctors and the nurses put into place. Non-clinical is 141, nurses 82, and you can see how many physicians we have there at 13. It's really a really good pie chart, which kind of explains that we really kind of try to concentrate on the clinical aspects of life up there at Memorial Regional Health. Finances, there's really a couple of highlights for stability, for financial stability for a hospital. One of them is accounts receivable. We try to keep this number as low as we can. So obviously the lower the number, the better. Accounts receivable is when we drop the payment to go out in the mail to the time we actually receive it. But there's so many obstacles in the way of getting those accounts receivable back with insurance, with, you know, government laws and so on and so forth. We can't say it enough that we really try to get lower, but sometimes this number is difficult. So our goal was less than 60 days for accounts receivable from the time we dropped the bill, and we ended in December at 67 days. So obviously another area we're going to try and work on. But again, some of this, our hands are tied with respect to how fast we can receive these funds back. The second aspect of a healthy healthcare facility is cash that you have on hand. This is a number that we obviously like to see bigger than smaller. And right now we're looking at somewhere in the neighborhood of about 60. Well, we ended the year at 63.7 days of cash on hand. I remember the days 3 or 4 years ago where we were down in the single digits. That was a rough time. I mean, everybody in the facility, I don't care who you were and in what department you were in, you thought about those days and you thought about, you know, how long do we have? So we're very excited to see that we're above 65 days or 63 days right now. And we're going to continue to have this on our radar to continue to see if we can't boost that up, because again, it just shows that we do have some cash in case something, you know, bad happened where we had to just kind of pull from our reserves and cash. And finally, just a kind of an FYI and a little trivia question. Anybody know how much money it costs to run the hospital each and every day? 1 day hospital charge to keep us open?
The slides.
That's not allowed to cheat. $172,526 a day to run the hospital. That's a lot of money. And I appreciate the hard work that our finance department and Jennifer has done to get that money. Again, the cash on hand, the accounts receivable going down. I think we're on a really, really good track.
I want to add a couple of things about the financials. We did last year, we got a notice from the federal government that they were going to take back $1.4 million. They did an audit on our disproportionate share payments that we'd received in 2018 and 2019. And the way it works with the federal government, when they say you owe the money, they start taking it and then you can contest it. But we did pay that $1.4 million back last year. We paid it over 11 months. But that was the equivalent of 8.5 days. And we paid that straight out of operations. We didn't have to tap into savings. So I mean, that was a factor in how we missed our mark. But we did have a very strong ending to last year. We did end with a $2 million positive net income. So it was a great year. I want to talk a little bit about our net revenue budget and where our money comes from, because I do hear a lot about the hospital as a tax supported entity, and we absolutely are a tax supported entity. We have three mills that are dedicated to the operations, but you can see from the pie chart, 95% of the net revenue, the money that we collect, is from patient services. So that's the services that we provide. We collect from insurance, we collect from patients. That's about $67 million. What we do get in property tax is about 2% of our net revenue budget, and that's $1.2 million. So it is a piece of the pie, but it's not the majority of the pie. And I know that, again, it comes up from time to time about how much money is collected from taxes. Also, I want to talk a little bit about our expenses and where we spend our money. And just like most employers, the majority of what we spend is on our employees. You can see we spent last year, 48% of our expenses were for salaries and benefits, and that was $31.3 million. The professional fees, $5.6 million, that pays for the providers that we have in our emergency department, our radiologists, and our inpatient doctors. And then Steve talked a little bit about our travel expense. So that little yellow piece, that 4% of that pie, that was what we spent on travel staff last year. That's almost $2.5 million. So it's really important that we work to get that number down. We did reduce it to 9. We ended with 9 at the end of last year, and I think this month we're sitting right at 8 travelers. We continue to struggle to recruit and in our therapies, rehabilitation, so physical therapists, occupational therapists. Our quality goals. So we set goals are related to quality. Quality of care is very important. Obviously, we're a hospital. We want to provide the best care possible. And we wanted to look at our likely to recommend. It's a question that's asked on our inpatient surveys. Are you likely to recommend this hospital? Or how extremely likely are you to recommend this hospital? It's very generic. It is, would you recommend this hospital for interventional cardiology? Probably not. Would you recommend this hospital for general medicine? Absolutely. Orthopedics for sure. But it just says, would you recommend the hospital? We wanted to be greater than or equal to 73%. And we did end the year with an average of 66%, not where we wanted it to be. But we're going to start digging into what is going into answering those questions. The next, we look at our quality improvement, quality assessment and performance improvement. We have a dashboard that shows a bunch of different metrics and how we're meeting those. We do great in timely and effective care and safety of care, which are two very important factors in providing safe care. And then we have some work to do in our readmission data as well as our patient experience. You can see in the next slide, it's a bar graph. There's 2 that were red. Those were the 2 areas that we missed the benchmark. The first one is in our hospital 30-day all-cause readmission. So we do not want to see patients come back to the hospital within 30 days of discharge for the same diagnosis. And this is all based on Medicare data. In Medicare's mind, that's not favorable. The benchmark was 14.6, lower is better, and we were at 14.7. We were just right on the bubble. Probably that was one readmission, but it's an area that, again, we're going to continue to bring that number down. The other red bar is the 30-day readmission specifically related to COPD, chronic obstructive pulmonary disorder, disease. Again, the benchmark is 19.3, want it to be lower, and we were at 19.6. So we just missed it. So we have two areas that we will continue to work on. In the next slide, this is our patient experience. We have areas that are green and red. The red are around recommending the hospital, as I talked about. Some of it is around communication with doctors and nurses. The other areas we have room to improve is quiet at night. It's definitely a challenge to be quiet at night, but if you're a patient there, that's absolutely what you want. So we're going to continue. These are metrics that we're always going to track, and we're going to continue to report on going into 2024. And then in our quality goals, I talked about safety of care. Every square is green except for that very lower left hand, which was the first quarter, and it was related to complications within 30 days on a hip and knee replacement. The number is 16.7, which is a huge number, but that represents one case. The numbers of services that we provide in that category are low, so when you have one of those fall out, it really makes an incredibly large percentage. But you can see that we have zero infection rate. We don't have catheter. We have very good quality of care. We're very proud of that, and we were recognized last year for our quality of care. I want to also finish today talking a little bit about the community impact that the hospital provides here in the community, because again, we're a tax-supported entity, but we are the community's hospital, and we want to give back and show our appreciation for the community. We cared for a little over 1,400 inpatient stays last year. We had 6,300 emergency department visits. We saw almost 32,000 people in our clinic, 32,000 clinic visits, 1,300 surgeries, over 66,000 lab procedures, almost 17,000 radiology procedures, 9,600 rehab, that's physical therapy, occupational and speech therapy. We donated over $35,000 in support of over 30 community events. We also invested $18,000 in direct patient assistance, and that's done through our population health program. We help people in need. We help people with food insecurity, housing insecurity, and that's money that comes through our population health department, and we give directly to patients. We brought back our community health fair. We put on our color run, which is, we brought that back a couple of years ago. It's been a great event we do in conjunction with the Balloon Festival, and we also volunteer at the community kitchen. That is something we're continuing to do quarterly this year. And speaking of community impact, the American Hospital Association did a study about hospitals and the impact they have in communities. And it was pretty interesting, and I wanted to share what that looks like and what that means in Moffat County. So they did a study that said for every dollar spent by the hospital, it generates an additional $2.30 in local business activity. I looked at how many of our employees live in Moffat County. 80% of our employees, 300 employees, live in Moffat County, Craig or Moffat County. So if you look at just what we pay our staff that live in Moffat County in just their salary, that's about $19 million. No benefits, that's just wages that we pay to our employees in Moffat County. So again, you look at that statistic about every dollar spent by the hospital, and this is conservative, it generates $2.30 in local business activity. That's $44 million that circulates through the community. For job creation, for every hospital job, an additional 2 jobs in a community are supported. So again, we have 300 local employees that conceivably support 600 jobs in the community. Hospitals do create an industry and an economy in a community, and they're really important drivers of that. And since probably the last 5 years, we have become one of the larger employers in the community since the mines and the power plant have started to reduce in staff. But I want to talk also a little bit about how hospitals and healthcare are hurting. It's an industry that's getting more and more challenging. There are risks of closure. Since 2005, 180 hospitals have closed nationwide. So far, none of the hospitals there hasn't been any hospitals in Colorado, and about 450 wide are at immediate risk of closing. But in Colorado, we do see 9 of our 43 hospitals, rural hospitals, are at immediate or high risk of closing. Some of the causes for this include leadership turnover. More than half of Colorado's rural hospital CEOs have turned over since fall of 2019. That's 24 of 43 hospitals. Ours was one of those. And 6 hospitals have faced CEO turnover twice in that same time period. Rural CEO turnover is up nationwide 18%. It is a challenging job that not everybody is up to the task. There's also been funding challenges. Many hospitals were propped up during COVID through the public health emergency with funding that came from the federal government. We certainly benefited from that through Paycheck Protection Program, and there was a lot of COVID money. We were able to save that money and put it in the bank and wait to see if that money was going to be given as a grant or if it was going to be paid back. A lot of it was grant money, but some of it was paid back. Some hospitals didn't have that luxury. They had to use that money to support their staff. And so when it came time to pay that back, that really put a lot of hospitals in a financial crunch. So that's part of the financial challenges. And then also, we're facing workforce shortages, increase in supply costs, and unlike general businesses, hospitals can't raise their prices to stay commensurate with increase in supply cost. We can do a price increase one time a year, and it's usually capped at a percentage around 5, 6, 7% when supply costs are going up in double-digit numbers. Some of the trends we've seen in Colorado around our legislative burden. This is a slide that talks about how many new laws have been passed in Colorado since 2019, and that's 368 laws specifically related to healthcare. We are in the process of implementing 21 major reforms. Some are federal, some are state, with respect to how we operate the hospital. Some of these are good. A lot of them have to do with consumer protection, which is necessary, but many of them are extremely burdensome in the administrative side. It often means we have to hire additional people that are not related to patient care in order to manage these programs. Additionally, healthcare is a workforce that's seeing a big uptick in workplace violence. Colorado hospitals, we have seen that in healthcare, we are 5 times more likely to experience a violent event in the workplace. And I can tell you on Friday, 4 of the employees at the hospital were physically assaulted by one patient. This is happening on an all too frequent basis. And this is, again, some of the challenge that we're facing when we're trying to recruit people. 2 of those people that were assaulted in our hospital were students. So you have students that are getting ready to enter the workforce, and this is the experience. And it's got to have you certainly make pause and say, is this really the career I want to enter? We are challenged with getting support from our legislators in supporting some changes to law to make the penalties more stricter penalties when you do assault a healthcare worker, but the challenge is getting them to understand that. But this has become my new passion project in making the hospital a safe place to work. Sorry, I can't turn the page. What's ahead?
Okay, real quick, we're just coming down the home stretch here. So I'm going to talk a little bit about what we've got going on for the 2024 goals that we've set forth for the hospital. I touched base on some of these already, but I just want to touch base on a few other ones that we're going to be working on. So key performance indicators, we want to achieve a better than a 75% on the QAPI dashboards. And we saw those earlier with the, the reds and the blue, reds and the greens. We want to achieve a 75% or above that with all that QAPI dashboard. So that's a lofty goal, but I think we can do it. Patient satisfaction, we obviously would like to see that go up on would you recommend the facility, and we would like to see at least a 66% or higher as measured through the Press Ganey. And again, Jennifer touched base on that. Press Ganey is very tricky. They really kind of give you the blunt of some verbiage that you either have to assume what it's asking or just kind of guess at it. But Press Ganey is a rough thing to read and follow, but we hope that we can get a 66% or higher on that. Staff education, we're certainly, again, we've got a little bump in the staff for them to increase their education and training. We like to see that because, the better off they are and the smarter they are, we certainly hope the better care we're going to get out of that. Identify and address areas for quality improvement through regular quality audits. We're certainly always doing quality audits. We've got a great quality department at the facility, and that team is constantly looking for areas to improve. Financial stability, again, she talked about how many facilities are closing throughout the United States and Colorado. It's scary to me, but we'd like to continue to maintain a high level of awareness with that. We'd like to work on our account receivable again. I talked about that. We'd like to achieve at least a 65-day of account receivable. If we can go above and beyond that, we're certainly going to smile and do that. We'd also like to achieve 66 days cash on hand, if we can certainly do that. Yeah, I'm sorry. I meant to say that we'd like to go below 65 days in accounts receivable and higher in 66 days cash on hand. Increase the time of collection. We're talking about doing this throughout the facility except for the emergency department. But we would like to at least see if we can get service and time of collection 90% in the hospital or 75% at the clinic. And I think that's an achievable goal. Employee engagement, again, we talked a little bit about employee engagement. We'd like to achieve the average satisfaction score of 85% or higher. Last year it was 84% at the end of the year, so we kind of bumped that up and hopefully we can accomplish that and make it even higher than that. Employee retention, we'd like to have that turnover rate less than 16% over the next year. And if you remember, last year it was at 24%. We're constantly looking at that and working through that. We've got our leaders, our middle management, our upper management, our executive management, certainly monitoring and making sure that we are on the right track to achieve those employee engagement goals. And finally, community outreach. We recognized at Memorial Regional Health that community outreach is huge, being seen in the community, helping run programs, helping to sustain some of the local organizations to continue what they do. We certainly want to support all those organizations. We'd also like to conduct at least 4 community engagement events or workshops throughout the years. Obviously, we'd like to see that more the better, but we're definitely want to be more engaged in the community as we see it. We are in the process of looking at creating and launching a community ambassador program. So that's it for what I have. Certainly willing to take any questions.
A lot going on.
We've
Yes.
got a lot going on.
Any questions?
I just made a comment. I'm
Yeah.
not supposed to say anything, but I always do. All you know me. And I can't not talk to me, but I really appreciate when the 3 of you appointed me to the hospital board. And I'll tell you what, it's been a really steep learning curve. Cities and counties are complex, but a hospital that times 10. It's like on steroids. It's crazy how much goes on at the hospital. And one of the things that's happened the last year I was there was the number of audits that you see. And there's hospitals being audited by everybody. There wasn't one sort of operation. You're looking at cleanliness. One auditor come back and said, "Here's a speck of rust on a sprinkler fire head in the kitchen." Oh my God, I'm kidding. But this is how picky they get. But we had 3 auditors, and they were from all over the country. One was from Texas, one was from Georgia, I don't remember the other one from. But at the end of their synopsis, they basically, the one auditor said, "Now listen, I travel 200 days a year. I go to hospitals around the country. I can tell you the good, the bad, the ugly, and the really ugly. I'm going to tell you what, this is one of the top 2 hospitals in the United States that I've looked at this year."
Yeah.
I was so proud of this hospital and what they did. But when you look at that, she said, "I have no fear whatsoever with bringing me or my family to this hospital." And sometimes there's things that you don't hear about. We hear about all the bad about the hospital. I've heard about the bad reputation of the hospital over the years. But this hospital is doing a great job. Jennifer's doing a great job. They were talking about employee turnover. She's talking about wanting local employees. I will tell you, I'm always harassing Jennifer about cherry picking the best of the best in Moffett County. Because she wants people who are local. She wants people to live here. She wants people that's going to stay. And there's nights I go up to the airport and hate when I'm flying out. I love it because it's mostly Moffett County people that are running that airport. And how nice is it to have that personal connection? It's the same way at the hospital. You go to this hospital, you have people taking care of you that are your friends, your neighbors, and they're doing the best they can for you and your family. I think there's a lot of comfort that you can take in knowing that we have this service here in Moffett County. Something we really felt.
Sure. Thanks, John. Appreciate that. I think it's important. We always say, no matter what the public thinks, if your employees and your board follows you, you're doing something right? No matter what everybody else thinks. And so Appreciate that very much. Appreciate that insight. Any other comments? Or-
Yeah, I just wanted to add that, Jennifer Riley does come to the commissioners once a month to give us an update. This is just not the first time
Mhm.
just being in this meeting here. And she was the one that suggested coming here to have it so the public that's here could see it. And I guess I could say for my time here as a commissioner, which this is my second term, that haven't seen any board members come to a meeting, whoever was the head of the hospital. So that's pretty cool to see some board members here. So, yeah, so.
Appreciate that.
And I would just add that it's not just the once a month meetings, it's very interactive in between and always easily accessible and pretty quick to answer. Appreciate that as well.
Well, we appreciate it. We appreciate the partnership we have with the county. I think there's lots of ways that we work together behind the scenes and in front of the, and, and also in public. And I think that's important. And a community needs to understand the partnership and that the support goes both ways. And we definitely are here to work with you. I know we've talked about some other ways that we might be able to support each other into the future as we know that the economy is going to be changing. And that was a question I had in my town hall meeting. What are we going to do about our changing economy? So we've been talking about that. And as we embark on our strategic planning for 2025 and beyond, those are definitely areas that we're going to focus on. How do we make the transition? There's a lot of new technology that's coming into healthcare. Artificial intelligence is one. And how are we going to deploy that in a way that makes sense and also makes us stronger? So that's just an example of something that we'll continue to look at and see how we can make some changes to make us stronger. Thank you.
Appreciate all the work
Thank
you
you.
guys are doing,
Yeah,
for sure.
thank you guys. Appreciate it. Thanks for the opportunity.
Thank you.
Yeah, okay.
All right, we do have one more. She's not here, huh?
She's not, but
Okay.
she wasn't sure if she would be.
Yep, do you want to just discuss?
Well, yeah.
We have one more item, discussing appointing a representative to the Rural Transportation Authority Steering Committee.
Yeah, so there's been a lot of work done around trying to get this rural transportation authority set up in a couple of the meetings. And I attended a meeting virtually in Hayden last week that kind of getting everything in alignment and trying to bring all of the elected officials and city and counties together and that are going to be potentially impacted by this. And looking at who for Moffett County would be our representative at the meetings and who would be going there and doing the work in between. And definitely not a huge focus from the county standpoint. I mean, it's an impact with our city residents. And the city is heavily involved in the RTA process and has helped pay for the study regarding that. But we still need someone at the table to hear the conversation and to be able to bring that information back to us. And so Heather Sloop has said that she would be willing to be our representative if we would like to have her. And so I would like to recommend that we appoint her, but I'll let you guys in on discussion before I make a motion.
Yeah, I think so. I mean, I think you sit on the RTA.
TPR, Northwest
TPR, yes.
Transportation, Regional
already,
Transportation.
And if you feel like that's a good fit, there's gonna be a lot of meetings coming up and a lot that we won't be able to make to everyone. So we do need to have a voice there and at least somebody coming back to us that has our interest at hand instead of maybe just the agenda of what people are trying to do. So I think I think it's a great deal. She's done a great job and so.
And she's highly educated in that. I mean, she's been super involved on the transportation, regional transportation work. And I think it's important to point out, it's not that none of us on this commission have time or have interest. It's just that we don't have time. So working through the tri-state transition process is taking a lot of time. That's not a once a month meeting. That's just a few minutes here and there. You guys are both doing stuff that you're super tied to. And so having someone who has the time and ability to hear what's going on at those meetings, provide us feedback and then take our feedback back is important.
Yep, I agree.
So,
Thank you, Heather.
yeah. I said I found a unicorn, somebody that's super involved, super educated and willing to work in between the meetings too. So with that, I would move to appoint Heather Sloop as our county representative for the Rural Transportation Authority Steering Committee.
Motion second. Any further discussion? Hearing none, all in favor?
Aye.
Aye. Motion carries. All right, well, that is the end of our agenda. Hopefully everybody has a good Easter weekend and our next meeting is April 9th. We're adjourned.
Slow down, it's slick.